first and foremost, just want to thank both Katie and Steven. Being a tech entrepreneur, this is my third startup. Came more from a mobile background before OpenPlacement. If we can just get a fraction of the interest and insight in senior care that we can in mobile and other verticals, I think we're headed in the right direction. So definitely think these guys are making this happen and having us here. As Steven alluded to, we are a member of Rock Health, which is a digital healthcare incubator based here in San Francisco. And we're very fortunate to be part of the organization. Quick background. We have seen through our process, through the past year of doing OpenPlacement, there's just huge inefficiencies with the transition of care. And there's just got to be a better way to find that next level of care for patients and their families. So real quick, just kind of some high-level numbers. So these are the people that we are ultimately doing this for. 1 in 5 seniors is hospitalized per year. Just some high-level thoughts around the space. 80% of those will require additional care after hospitalization. So it's really important to find that next level of care. Each day that somebody is in that hospital beyond their length of stay today is on average around $2,000 in costs. At some places like Stanford, which is more of the high end, it's around $8,000 a day of cost to the hospital. And right now, today, hospitals and skilled nursing facilities are spending over $2.5 billion a year in the transition to care. So meet Kat. This is one of our users. This is who is currently using OpenPlacement today, which is a B2B platform. It's not designed for consumers right now. Kat is your hospital discharge planner when mom or dad need to leave that facility. It's 5 p.m. on Thursday. This is the classic story. She's been given discharge orders to move your father by end of day Friday. She needs to find that next level of care. What is she doing today? And we've spent hours, if not more, every week with different facilities across the Bay Area where we're primarily focused, and we really try to figure out what they're doing through these processes. She has a stack of brochures on her desk. They literally pull them out. They're this thick of facilities in the Bay Area. She has the yellow pages, of course. She has Google, where she might do a search for assisted living that can meet the needs of her patient. And she has the list. And this is innovation today in the space. And I carry this around with me all the time to remind us why we're building OpenPlacement. This is what they give the family and the patient today in a hospital. This is a real list. This is somebody we recently met with at Rock Health whose loved one was in a facility in New Jersey. They need to find that next level of care. They gave her this, and she's looking at it. How am I supposed to know not only who's good and who's not, but who's even has an availability for mom right now? What I love too, at the bottom it says, please go to Medicare.gov for more info. and the one from El Camino right there, which you can't see at the bottom, it says the list was created in 2011, please verify the information. And this is what they're doing today. So there's providers out there for those patients. But it's a frustrating process today. It's back and forth voicemail, it's too expensive, it's no vacancy. Meanwhile, there is a perfect place out there that they have no visibility into. They have no idea they even exist. So introducing OpenPlacement. OpenPlacement, the concept has been around for over a year now. We've been deployed here in Northern California it's about 3 months ago now. What our tool basically does is it allows these professionals, these discharge planners, to log in a few easy steps, see what providers are out there, connect quickly and efficiently, and make that discharge a lot less painful than what's being done today. Just real quick on our team and who we are. Dominic Scotto, he's kind of our visionary. He's been in non-medical home care for over 10 years in the Bay Area. He has one of the largest non-medical home care agencies in the Bay Area today. And he really saw the vision for OpenPlacement. Justin Usher, who's here, somewhere in the back. Justin comes from Quinn Street, had a lot of experience in the senior care space, more from an online lead gen marketing type standpoint, and worked with places like A Place for Mom, and intimately knows that business. And then myself, I come more from biz dev, finance background. I worked a lot in consulting, investment banking, primarily focused in the healthcare space at my investment bank, and I've done prior startups. And that's really OpenPlacement. And you can feel free to connect anytime.
All right. You don't have to be really nasty, but you can be as nasty as you like. This is open house. Go.
Revenue model.
Sure. So it's very simple. We know today we don't want to go into a hospital and try to sell them an enterprise solution, a painful tool. It just takes time. Long term, sure, there's white label value-added premium services we can give them as we build our network, but we monetize on the intake side. So it's a provider, a senior care facility, will pay us a monthly subscription to have visibility into the hospitals. Where there's true value there is boarding care facilities, 4 or 5 bed facilities that El Camino or Stanford have no idea even exist. How do we get them in front of that discharge planner? So they'll pay us a monthly fee to be on the platform. And then we also take a referral fee, which is industry standard. Companies like A Place for Mom take 50 to 100% of first month's rent. That's why it's such an attractive business model to them. We could come in and take on average half of that. So that's how we make our money.
Thanks. Yeah, there's a question right there next to you.
There's a lot of, questions going on. You have a date, find a place, and, many of those questions are more than just, looking at a list of centers that may be right. And within the hospital, discharge planner talks to the family. The social worker is intimately involved with finding out about the payment opportunities and the different payment options that the family has and what services, whether Medicare or Medicaid would be funding for those centers and whether they have Medicaid beds or Medicare beds, et cetera, et cetera. Do you include or do you do any vetting of the home care centers for living versus home care agencies, for these types of services is number one. Number two, are you looking at developing any kind of hierarchy or best of breed, after you get more data on these centers within the different communities?
So very good question. So we do provide them as much information as possible that's currently out there today. So we integrate with Medicare.gov. The discharge planner can go onto OpenPlacement, see 5-star quality measures for Medicare facilities. They can see penalties, any violations. We give them that information at their fingertips. To your point, we don't want to be seen as OpenPlacement as somebody that says this is the right place for mom. We need to give them choice. And right now, today, they have that list that I showed you before, and they need to have, that's a very narrow choice option. And meanwhile, they have no idea if they're going to open, what their price range, all that information. So how do we open that opportunity for them in terms of where to send that patient? And to your second half of the question, without question, as we build this network, there's lots of valuable data information we can provide to discharge planners. Like any market-based system, like any open table travelocity type model, it takes time. So over time, we do think we can provide more unique information and quality measures, but again, that takes a little time today.
Question, right? Yeah, there's a microphone.
Oh, most people are discharged to SNFs.
That's right.
They're not discharged to board and cares.
Mm-hmm.
So are you primarily marketing to SNFs, or are you marketing to the SNF discharge planners who are going to make the long-term placement?
So you bring up a very good point. So hospitals a lot of times will discharge to home, where they'll kick the can down the road to a SNF, and then they have they have their 30 days or whatever, they're there, and then they go to the next level of care. Hospitals are a little bit tougher to get into, obviously. It just takes more time. There's more buy-in required. So we are focused primarily on SNFs right now because they can use the tool for discharge and intake. So for them, it's a little bit easier a value proposition. Hospitals, we do see a lot of opportunity for them to use the tool, but that hasn't been our primary focus, to your point.
Yeah, question.
I'm just curious about how good a handle you have on how the family makes a choice. Like there's quality measures, but there's also like what's it feel like and like
Yeah, they gotta taste the cookies and they gotta go into actually see the tour.
photos, reviews, videos. I don't know what it would take.
So the number one criteria we found, just doing this for a while now, is budget. I mean, the family has their impression of the facility that overlooks the cliff, the beautiful views. Meanwhile, it's 10x what they can afford. And that's why the discharge planner is so critical. They need to figure out where's the starting point and give them those options. It's really important for the patient to be involved in this process. And what these people can do today with OpenPlacement, they can do a search, find 10 places they think are a good fit, and with one button, print that custom list now, or email that list to the family and get them involved as well. So that's how we tackle that.
Just a point, if I place my mom in the center and I listen to the discharge planner and she says this, with the team that's involved in the discharge, and I'm unhappy, we get out there, and I know this has happened to me with my mom several times, where there's just no way, this is not going to work. And so we when you call the hospital back, talk to the discharge planner, they're like, oh, well, I've got so many patients right now, let me put you in touch with the social worker. And so the key person is not just the discharge planner, but it's really the team of the social worker, discharge planner, and geriatric care person whom the hospital has on staff and can be made available, for these kinds of things. And so I guess it's just a question whether or not, just having the data, let alone not just having a conversation with somebody to be able to really help them to decide where to go is is that an important part, do you think, for you guys, or are you guys not going to look at that?
Well, you bring up a great point. I mean, there's a whole team involved with this process. I use the term discharge planner, but it certainly includes the social worker, case manager. A lot of hospitals kind of have synonymous terms, and it's a little bit different. But more or less, you're right. There's a team around this process that needs to have this information. Now, we're not looking to replace that professional. There's still a need for that hand-holding, for that person to be with the family, show them information. But what's critical for us is giving them the best information that's out there and letting them do the process of walking them through, giving them more information. We're not going to replace that yet, in any time in the near future.
Dan.
Have you considered offering this product in a more proactive sense so that instead of working at the triage level where the patient is being discharged tonight and they have to go somewhere tonight, perhaps a month or two before that, they've already been considering their options, knowing that they're moving into a situation where ill health is going to happen?
So it's a great question. I mean, for us, we're really more focused on the professional community during this process. I mean, there's great resources like Caring and other sites out there that do have that information. Now, for us, we do see an opportunity to eventually loop in the family and the patient and the consumer, essentially, where they can go in and get more information and learn before they have to actually, it's that critical moment. But for us, our focus is really on, I have this patient, I need to move them to that next level of care right now. What are the best options? Because a lot of times with the family, what I've learned, I mean, I've been fortunate enough not to have to deal with this with a loved one, knock on wood, but this is such an event-driven thing, right? People never, ever think about this. We hear it all the time when we meet with folks at hospitals and nursing facilities and families. But when that event does happen, how do we give those people that are critical to the family and the patient the most information?
Great, last question.
I just want to make a statement. I think a good discharge planner will start their discharge planning the moment the person enters the facility.
Right. Discharge happens a lot at admission, and you're absolutely right. But these people, what we found, traditionally they were more RN type positions, a discharge planner. A lot of them now, some facilities are going more to a kind of a clerical position. This is somebody who has 30 people they're dealing with on their caseload, and frankly, they're just bogged down. It's time for them. How do I make this more efficient? And it's not good to say that, but it's frankly, they're just very busy people that need to get these people to the right level of care.
But they can hand out the same list when the person comes in versus when they're...
They can. You're absolutely right. You're absolutely right.
Excellent. Great. Thanks very much, Kathy.
Thanks, guys.